Here in the desert, many of us are active. We love hiking, walking, cycling. Rigorous or even light exercise can lead to injuries and put pressure on the knees. Here to tell us about modern total knee replacement, including advances in materials, technique, pain management, rehabilitation, and custom total knee replacement, is Dr. Raj Sinha. How are you?
I'm great, Brian. How are you?
I'm very well. Welcome to the show.
Thank you so much for having us.
Yeah, of course, of course. So I've got some questions for you. Obviously, we've got a lot to cover here in a little bit of time. Tell me a bit about orthopedic knee. What exactly do you do? Let's start with that.
So my specialty is knee replacement. So people typically think of that as being some major operation where we cut out the entire knee out. But in modern times, it's really more of a knee resurfacing. We trim the damaged bone and cartilage, remove it, and then replace it with metal and plastic after we realign the patient's leg.
Okay. And total knee replacement, that's a whole different
So that's exactly
approach.
what total knee replacement is, what I just described there.
Okay.
It basically means that we're replacing or resurfacing all three areas of the major compartments inside a person's knee.
How long have surgeons been using this practice?
Total knee replacement has been around since the early 70s, and it's gone through a lot of refinements over the last 5 decades.
Tell me about some of the changes through the years.
Well, initially the problems that we had with total knee replacement had to do with the manufacturing.
Okay.
There were certain materials that were able to be used from an FDA standpoint, and they had certain limitations. And so design didn't really change very much over about 50 years. There were minor tweaks. We got a little bit better with the sizing and made the implants a little bit thinner. But within the last 5 years, because of things like 3D printing, we've been able to radically change the design of knee replacement.
So in the past 5 years, just big changes.
Well, in the last decade, things have started, and then with total knees, it's the last 5 years that the new manufacturing techniques have been available.
How long do these knee replacements last?
The good news is the metals will last forever that we use, the alloys. The plastics used to be the weak aspect of the entire equation, and the manufacture of plastics has gotten better in the last 2 decades to the point now where we expect them to last 30 years or more.
So with that being said, how durable are these materials that are being used?
The durability is quite high. In fact, I tell most of my patients, once you've had your surgery and recovered from your surgery, good strength, good flexibility, you have no restrictions from my standpoint. Do any activity that you feel comfortable doing. Now, the caveat to that, of course, is that not everybody can do everything after they get a knee replacement. A lot of that has to do with other issues that they have regarding their health and their overall fitness. But I have patients who jump out of helicopters and ski, scuba dive. I have a couple champion power lifters after their joint replacements. So it's really up to the individual and what they can accomplish. The artificial joint is no longer the limiting factor.
Okay. So what are some advantages with this? Obviously, some of the obvious, but...
With the customized knee, you mean?
Correct.
So historically, over the last 5 decades, knee replacements came in a set number of sizes. They all basically had the same shape. You can imagine with 8 billion people on the planet, there's more than 5 or 6 shapes, right? There's infinite number of shapes.
Right.
But by and large, from a pain relief standpoint, they did really well. People did really well with them, they were happy. But when we got into more of the detail on patient satisfaction and outcomes, about 15 to 20% of people were dissatisfied with their knee replacements. They felt stiff, they felt too big, they felt bulky, et cetera. So when the surgeon started diving into why are these people unhappy with it, it turns out that about 15 to 20% of the times, we're stuck in between sizes. And the surgeon has to make a call in surgery. Do I make it too small or do I make it too big? With the customized devices, we 3D manufacture the implant exactly to the patient's shape and fit. So it's a perfect fit every time.
All right. Learned a lot. I appreciate you, doctor. Thank you.
Certainly.
And thank you, everyone. See you soon.